From MTN News, this is Montana This Morning.
Well, drunk driving, a big problem in Montana. Now the state about to add another way drivers could become impaired. Coming up, how legalized marijuana could affect your safety on our highways. And a lot of people taking advantage of the new child tax credit. Coming up, a check-in on how that program is working and what it means for parents. Beautiful shot this morning on our iCam. It is 6:28. Chet Lehman, Matt Elway with you here on our Monday, working our way through a lovely, little chilly, but not bad. Yeah. Well, West Yellowstone, it's a little more than chilly.
I was just looking at that number there. Yeah. Right now, 28 degrees in West Yellowstone. It is a cool morning there. A cool morning across the area. These temperatures into the low to mid 40s, not bad. Certainly does help us out with our fire conditions. Unfortunately, we don't have any rain in our forecast for the next 24, 48, or really the next week, to be quite honest. Our rain chances are pretty slim throughout the week, even with a cold front slated to move through later Tuesday into Wednesday. Temperatures into the 80s. It is going to be a nice warm afternoon. We do have smoke building back into the area. I'm going to break that down, of course, coming up in just a few minutes.
All right, thank you, Matt. Just ahead of 6:30 now on this Monday, Montana voters approved legalized recreational marijuana use last year. It was a vote that caused a lot of debate in the state legislature on how to make it all work. So come January 1st, Montana is in the pot business, and that's going to pose a lot of new questions for the state. Joe Valley takes a look at how both law enforcement and scientists are preparing.
Montana already struggles with our rate of drunk driving, and in a few months, the state's new recreational marijuana law comes into play. It will no doubt put more impaired drivers out on the roadways. So how does the Montana Highway Patrol feel about this? And what about the state crime lab, whose scientists will likely see a bigger caseload because of this? Well, as we found out in our ongoing Under the Influence report, they're already gearing up. At the state crime lab in Missoula, high-tech machines like this one screen blood for a specific classification of drugs, pinpoint what the drug is, if it's meth or opioids or marijuana, and then another one measures the level of that drug in a blood sample. Machines called ELISA, or a gas chromatogram mass spectrometer. Pretty big words, but they are crucial testing tools used all the time in impaired driving cases.
The toxicology section receives about 5,400 cases a year, and I would say about 4,000 of those are DUI cases.
That's a lot of impaired driving cases. The crime lab experienced a drop-off in DUI testing during the COVID lockdown, but once businesses reopened, the caseload increased. Often, it's a drugs and alcohol situation when someone is pulled over.
When you're talking DUIs, it could be from ethanol or it could be from drugs. And we'll immediately run the blood alcohol on it, the ethanol on it. And if anything below, we've set a mark at 0.1, so anything 0.1 or below automatically triggers a drug test as well.
Come January, recreational marijuana will be legal for sale in this state. With alcohol, you're considered impaired with a BAC of 0.08. It is different for marijuana.
There is a per se for marijuana as well, and it's 5 nanograms per milliliter. So that's the amount that you can have for you're legally over.
The crime lab in Missoula says marijuana, meth, and alcohol are the things most often popping up on a DUI drug test. It currently has 8 full-time toxicologists, but recently asked the legislature for 4 more scientists over the course of the next 2 fiscal years. This in preparation for an anticipated demand for testing. Nearby Washington State legalized recreational marijuana in 2015, so I called the Washington State Patrol to ask what impact did that have out on the roadways. They told me they don't differentiate between the kinds of drugs involved in impaired driving, but anecdotally, the officer told me they did see an increase in impaired driving once marijuana became legal. Highway Patrol spokesman Sergeant Jay Nelson also says they anticipate they'll have more impaired driving arrests once marijuana becomes legal. However, troopers are already trained to identify what might be impairing a driver, be it alcohol, drugs, legal or illegal, or anything else that may cause somebody to get pulled over.
We have what they call the ARIDE training, which is the Advanced Roadside Impairment Detection. And really what that is looking at is beyond the basic maneuvers that we see for alcohol impairment. Now there's different things that we look at for impairment with illegal or prescription drugs. We don't want to forget about that. And so we have all of our troopers across the state, most all of them are trained at that level, and then we're increasing every year more drug recognition experts. So these are troopers that have had even more training in really the examination of individuals to determine whether they're intoxicated.
However it pans out come January 1st, law enforcement and the scientists, well, they're ready to adjust to an ever-changing landscape out on Montana's roads.
We're starting to see other drugs creep in, and those are things that we have to prepare for. It's an epidemic that we all need to do our part to help cure.
And I was in Spokane, Washington recently. I did hear several public service announcements regarding marijuana use, explaining how edibles work and how this generation's marijuana might be different from what some remember from years ago. The tagline was, "Drive high, get a DUI." It's all part of an awareness campaign that is no doubt coming to Montana in just a few months. In Missoula, Jill Valley, MTN News.
6:34 now. It's a benefit that millions of eligible American families have enjoyed the last 2 months. A monthly check from the IRS help raise your kids. Monthly child tax credit was promised as a means to end child poverty. So now, 2 months in, is it working? Our Joe St. George goes in depth for us.
The middle of the month has never felt so good. On each one of these dates, tens of millions of eligible American families received monthly child tax credit payments. Checks will continue to be deposited through the rest of the year on the 15th of the month. And while everybody likes money, a big question for policymakers: have the monthly child tax credit payments decreased poverty?
Our estimates show a notable decline in the monthly child poverty rate.
Meet Zachary Parolin. He's with Columbia University's Center on Poverty and Social Policy.
So initial estimates suggest that most recipients of the first payment of this expanded child tax credit are spending the majority of that $250 to $300 per child on food.
How does he know? Well, each month the U.S. Census Bureau sends out what's known as the Household Pulse Survey to about 1 million households nationwide. One of the questions they're asking now is, did you receive the child tax credit? And how are you spending the money? Those questions and others allow Parolin to calculate a poverty rate, which he says has drastically improved since the payment started.
We're estimating a reduction in child poverty of about 25%.
Columbia University Center on Poverty and Social Policy reports in June, before the monthly checks, the child poverty rate was 15.8%. In July, following the first payment, it fell to 11.9%. That's around 3 million fewer children living in poverty.
We're on track to cut child poverty in America in half.
It's not been a perfect implementation, though. President Biden promised a much bigger reduction during his address to Congress earlier this year. And while Parolin says that's still possible, the reason poverty hasn't been cut in half yet is because many of America's poorest families who haven't traditionally filed taxes haven't signed up to receive the money. Parolin believes 3 to 5 million people could be getting checks but aren't because they aren't in the IRS's system.
It's those families that didn't earn enough to have to qualify for paying taxes, that don't receive the payments automatically and have to do some extra work to sign up and actually receive the benefit.
For the moment, parents, it's only a perk for 2021, which means there are only 4 of these payments left. There are efforts on Capitol Hill to make it a permanent perk, but so far that's included in a budget reconciliation package that still has several weeks, if not months, of negotiations to go, and there's a chance it doesn't pass at all. On Capitol Hill, I'm Joe St. George.
6:37 now, and other headlines this morning. Many Americans are starting to reconsider fall travel plans because of the Delta variant. But if you're going to take the trip you've been putting off, Chris Conte shows us some insight about updates to travel insurance, policies you'll want to know about.
Everything in the Mexico Riviera Maya is shutting down by 5 p.m.
These days have been busier than ever for Tony Guy.
They were booked months ago.
He's a travel agent doing his best to keep up with demand and a few other things.
You gotta watch the news. You gotta watch the weather. You gotta watch each destination because it changes.
A hurricane in the Pacific, tropical depressions in the Atlantic, and those storms are far from the only uncertainty swirling around Tony right now.
Every single day there's something different, something new. You can't keep up with everything that's happening in this world.
Longwood Travel is still trying to reschedule trips from 2020, most of whom are travelers who purchased trip insurance. And with the current surge in COVID cases, Tony can't in good faith let people book new travel accommodations without some kind of coverage right now.
A lot of people don't realize that they need it until they need it.
Look at what you're putting up front. Right?
That is Michael Giusti, an analyst for InsuranceQuotes.com. He has seen a substantial increase in the number of Americans buying trip insurance this year.
A lot of things we took for granted and just thought, that could never happen, all of a sudden became our reality.
Some important things to remember about what travelers insurance does not cover. You can't cancel a trip out of fear and get a refund. Travelers insurance also doesn't cover government lockdowns. But one of the biggest reasons to consider travelers insurance right now, especially with the Delta variant surge, many policies will cover your expenses if you get COVID abroad. If the country you're in doesn't have facilities to treat you, most policies will pay for your medical evacuation back home.
Insurance is there for the risks that keep you up at night, right? The things that you can't control.
If you're spending $8,000, don't you want to protect it? Anything can happen.
That brings us back to Tony and why your family may also want to consider using a travel agent during the pandemic. See that spreadsheet? Travel agents have exclusive access to lists letting them know which resorts might be offering free COVID testing for travelers. And Tony's also getting updates on countries' health policies in real time.
If you stay 3 nights longer for 2 people, it's free.
Just another part of navigating life and travel during this pandemic. I'm Chris Conti.
Once again, preparation is key when you're planning to do something like that. 6:39, we're going to take a break. When we come back, first responders been on the front lines of the COVID pandemic for going on 2 years. Coming up, find out how to help kids of those workers who paid with their lives, getting a helping hand in college. But first, here's a preview of what's coming up at 7 o'clock on CBS This Morning.
Good morning. Ahead on CBS This Morning, Hurricane Ida smashed into Louisiana overnight, tearing roofs from buildings and flooding roads. We have teams across the state as more than 1 million people are without power right now. Plus, a look at where the storm is headed next. Also, Ida struck 16 years to the day after Hurricane Katrina devastated Louisiana. We'll talk with the FEMA administrator about the biggest concerns about this storm. And tributes to American heroes. We'll show you how the service members killed in last week's terror attack in Kabul are being remembered. All that and more at 7.